Welcome back to the Deep Dive, where we take these huge global reports and we pull out the knowledge you actually need. We turn that mountain of data into immediate insight. And today, we're starting with just a staggering contradiction.
You really is.
We have these two incredibly pervasive, health-harming products, alcohol and sugar-sweetened beverages. And despite the huge human cost, the crushing financial burden, the taxes meant to curb their use are, well, they're fundamentally broken.
They're broken and woefully underutilized. It's a spectacular global policy failure, and it's hiding in plain sight.
And that's what we've been looking at.
Yeah, we've been deep diving into the World Health Organization's 2025 global reports, specifically on the use of alcohol taxes and SSB, that's sugar-sweetened beverage taxes. The data is fresh, too, right up to July 2024.
So our mission for you, the listener, is pretty essential. We are going to unpack the global state of these health taxes. We'll analyze exactly why their design is structurally failing.
Then, and this is the kicker, we reveal the extent to which these harmful products are actually becoming more affordable, not less, in most of the world.
Seems completely backward.
Because the logic for using these taxes, these excise taxes, is so compelling. It's supposed to be a win-win-win strategy.
Win-win-win. Okay, what does that mean?
Well, first, it's a win for public health. You reduce harm, you avert massive future healthcare costs. Second, it's a win for government revenue. I mean, we're talking billions. And crucially, it's a win for health equity. Price increases tend to disproportionately reduce consumption among lower-income groups who, unfortunately, bear the greatest burden of the disease and harm that comes from these products.
Okay, so let's unpack that. Let's start with just grounding ourselves in the scale of the problem here, because the numbers, they're immense. Alcohol first. The WHO labels ethanol not just as intoxicating, but as a psychoactive and toxic substance. And the toll it's devastating. The harmful use of alcohol results in the deaths of approximately 2.6 million people every single year.
And that's 2.6 million premature deaths. They're tied to this whole host of problems, non-communicable diseases, or NCDs, like cancer, liver disease, but also mental health damage, injuries, poisoning. The burden is just enormous.
And then for SSBs, for sugary drinks, the problem is maybe more pervasive because they seem so harmless.
Exactly. They are leading sources of free sugars, which we know are strongly linked to the global obesity crisis, type 2 diabetes, cardiovascular disease, and, of course, dental decay.
And it's not like consumption is slowing down.
No, it's accelerating. The data we have shows that worldwide consumption of soft drinks, and that's excluding plain water, it actually went up by about 14% between 2013 and 2024.
And wow, so that trend just underscores why we need some kind of aggressive policy intervention right now.
It's urgent, which is why the policy goal is so clear. Use excise taxes. The WHO strongly recommends them. It's part of their safer package for alcohol, a strong recommendation for SSBs.
And the goal isn't just revenue, right? The tax has to be effective enough to actually change behavior.
Precisely. It has to decrease affordability, reduce consumption, and curb these harms. But while most countries do try to tax these products, it's the structural details that reveal this systemic failure.
Okay, let's get into those details. Let's start with coverage. Who is actually applying these taxes?
So globally, 67 countries apply national-level excise taxes to alcohol, and 116 countries do it for SSBs.
That sounds pretty good, actually. A lot of momentum.
It sounds good on the surface, but here's where it gets really interesting, because the loopholes in the policy structure are just massive.
Okay.
The most glaring, just counterintuitive alcohol loophole is the exemption of wine.
Wine?
Yes. The WHO explicitly recommends that excise taxes should apply to all alcoholic beverages. Otherwise, consumers just substitute one form of harm for another. You tax beer and spirits, but not wine.
You're basically pushing people towards wine.
You are nudging them. But the reality is that at least 25 countries exempt wine from excise taxes entirely.
25?
That's right. And the concentration of this failure is striking. In the WHO European region, it's 42% of countries. Nearly half.
So they're just ignoring the public health.
They're effectively subsidizing one type of alcohol consumption, usually for cultural or historical reasons, and it just overrides the health imperative.
That's a huge defeat for public health before you even start.
It is, and we see very similar structural flaws with SSB taxes. The tax base is often way too narrow.
What do you mean by that?
So most countries that tax sugary drinks do not tax other high-sugar drinks. For example, only 46% tax 100% fruit juices.
Even though they can have a ton of sugar.
A ton. Only 52% tax sugar-sweetened ready-to-drink tea or coffee. And for sugar-sweetened milk-based drinks, that number just plummets to 27%.
So if the government taxes soda, the industry just moves its sugar into juices or coffees or milk drinks that are not taxed.
Exactly. It incentivizes the industry to shift its product line into these untaxed categories, not to actually reformulate and make healthier options. You're only targeting the soda bottle, not the harmful ingredient itself, the free sugar.
Okay, but if that isn't incoherent enough, there's this major contradiction you found.
This one is truly counterintuitive. Get this. 45% of countries that tax non-alcoholic beverages also apply excise taxes to unsweetened bottled water.
Wait, they're taxing water?
They are?
They're taxing the healthy substitute.
Yeah.
That's completely incoherent. If the goal is public health, you're actively steering consumers away from the one thing they should be drinking.
It shows a fundamental incoherence in the policy design. It's prioritizing simple revenue generation over specific behavioral public health goals.
Okay, let's move from the coverage gaps to the nuts and bolts of the tax design, because this is where the policy failure really accelerates over time. We need to talk about ad valorem versus specific taxes.
Right. These are the two main ways to do it. Ad valorem just means the tax is a percentage of the price, like a sales tax.
So a 10% tax on a $10 bottle is $1.
Exactly. Specific tax is a fixed amount, say 50 cents per liter, no matter what the price is.
And why does that difference matter so much?
Because specific taxes are generally the better policy tool. They have a massive advantage. They effectively target cheap products. That fixed 50 cents on a $1 product raises the price floor by 50%.
But on a $10 premium product, it's only a 5% increase.
Precisely. It curbs the consumption of the cheapest, most heavily consumed options. It's crucial for equity.
I see. So the price increase hits the most accessible stuff the hardest.
It does. And conversely, ad valorem taxes, they're vulnerable. They rely on the declared value of the product, which means they are much more prone to industry tax avoidance strategies, underreporting the value.
And we see that in the data, right?
Mm-hmm.
Ad valorem is pretty common for SSBs, and especially for alcohol in low-income countries where oversight might be weaker.
That's a huge vulnerability. Now, the gold standard goes one step further. It's a content-based specific excise.
This means you're taxing how much pure alcohol is in the bottle, not just the volume of the liquid.
Exactly. And for spirits, this is the most used system globally. 66 countries do it. This is a public health win.
How so?
Because tiered taxation based on alcohol content, it does two great things. One, it encourages consumers to choose lower alcohol options. And two, it incentivizes the industry to reformulate and produce lower alcohol products.
So the policy is saying if you make your product less harmful, you pay less tax. That's a really targeted intervention.
It is. It drives public health victories. But here is the major lag. Look at SSBs. Only 25% of countries account for sugar content in their excise tax design.
Only a quarter of them.
Yes, they're still just taxing the volume, not the sugar. It's a massive missed opportunity to use the tax system to directly target the harmful ingredient.
Which brings us to what you called the most critical design flaw of all. The one that guarantees these taxes fail over time. The erosion catastrophe.
This is truly key. I really want the listener to get this. Those specific excise taxes, the good kind, the fixed rate kind, they lose real value every single year because of inflation.
Unless they're adjusted.
Unless they're automatically adjusted. Imagine your government sets a tax of 50 cents on a can of beer today. In 10 years, that 50 cents buys way less, and average incomes have gone up.
So relative to everything else and relative to my growing income, that can of beer effectively gets cheaper every single year.
That is the policy backslide. If the tax stays the same while prices and incomes rise, the product gets cheaper in real terms. It completely defeats the purpose of the tax.
The numbers on this are pretty staggering.
They are. Globally, fewer than 1 in 4 countries, only 23% mandate a regular automatic adjustment for their alcohol excise taxes.
So in 3 out of 4 countries, that tax is just on a ticking clock, guaranteed to become less effective.
Yes, unless a politician manually steps in to raise it. And for SSBs, it's even worse. Only 14% of countries with specific SSB taxes automatically adjust for inflation by law.
Only 14%. That means in 86% of countries using the superior tax design, that tax is guaranteed to fail its mission over time. It's a system designed to systematically fail.
It is a structural leak in the revenue system, and it leads directly to the affordability crisis we see now.
Okay, so the design is bad, the coverage has loopholes, the value of the tax is broken. Let's look at the result. How ineffective are these taxes right now?
Critically ineffective. When we look at the global median excise tax shares, What percentage of the final price is actually the tax? The numbers are really low.
Okay.
For beer, it's 14%. For spirits, it's 22.5%. Low, but, it's something.
But the truly eye-opening figure is the SSP tax share.
It is abysmal. The global median excise tax share for a standard 330 milliliter sugary drink is a shocking 2.4%.
2.4%. The tax is basically a rounding error in the final price.
It is. Let's put that into real money, using purchasing power parity dollars so we can compare fairly. The average worldwide price for a 330 milliliter beer is PPP $2.47. Of that, the excise tax is about 52 cents. So 21%, a measurable price signal.
Right. Now compare that to sugary drinks.
The average price for that same size SSB is PPP $1.56. The excise tax component of that is a meager 15 cents.
15 cents.
Which is only 9.7% of the price. And remember, that's the average. The median, as we said, drops to 2.4%. The tax is functionally irrelevant to the consumer.
And if you look at it by the actual harmful ingredient, by the sugar,
it's a negligible fine. The tax per 10 grams of sugar averages only about PPP 3.8 cents globally, less than 4 cents for a spoonful of sugar. It's not a penalty.
And this leads us to the most disturbing trend of all these products are getting cheaper.
The affordability backslide. This is the ultimate proof that the erosion catastrophe is real. We found that between 2022 and 2024, alcohol became more affordable in most countries.
They're affordable.
Yes, in 56 countries for beer and 67 countries for spirits.
So even as incomes were rising, the price of these harmful products wasn't keeping pace.
That's the key takeaway. The prices are not keeping up with economic growth. They're becoming more accessible, meaning the policy is unintentionally encouraging consumption. SSBs, same story. More affordable in 62 countries.
The systems are failing their core mission.
They are.
Regular updates and smart design matter immensely. But before we finish, there's one mechanism that can help build public support to fix this. Earmarking the funds.
Yes, exactly. Earmarking the revenue for health programs can really help gain public support. It transforms it from just another tax into a targeted investment. We know 28 countries earmark alcohol tax revenue, and 10 do for SSB tax revenue.
And they put it toward things like NCD prevention or health coverage.
Exactly. The public can see a tangible benefit. It provides coherence.
And looking forward, the WHO has a new goal to try and reverse all this, right?
They do. They've launched the 3x35 initiative. It's a call to action. It aims to increase the real prices of 3 health-harming products, including alcohol and sugary drinks, by at least 50% by 2035 through tax increases.
So that shows the scale of the reversal that's needed.
It does. They understand only massive systemic tax hikes and policy fixes can reverse this.
So the synthesis here is pretty stark. Excise taxes on SSBs and alcohol are globally underutilized. They're riddled with loopholes like the wine exemption, and they are just not designed well.
The real lesson from these reports is that policy maintenance, especially that automatic adjustment for inflation, is just as important as the initial tax rate. Since most countries are allowing their taxes to erode every year, governments are essentially guaranteeing that consumption will increase. They are subsidizing the affordability of harm.
It's not just a health tax. It's a systematic failure of policy maintenance, a structural leak. So the final provocative thought for you to consider. If governments are failing to implement the simplest economic safeguard automatic inflation adjustments, the real question isn't if they should raise taxes, it's whether they can afford to run a system that systematically subsidizes harmful consumption through such basic design flaws. What specific, measurable action could you look for your own government to implement today to stop this tax erosion? That's something to chew on.
Until next time, stay well informed.
And keep diving deep.